Mrs. Smith, you have been diagnosed with bruxism by Dr. John. So today I'm going to explain to you what bruxism is. I will educate you on the causes of bruxism. I will tell you how it affects the mouth as well as areas around the mouth, including head, neck, and your ear, as well as the joint over here called temporomandibular joint that is connected to the jaw. And I will tell you all the treatment options available, which include medications as well as restorative and orthodontic procedures. And in the end, I will discuss the fees related to all the possible treatments out there. Bruxism is a dental term used to describe the involuntary clenching, grinding, and tapping of teeth. There are two types of bruxism: awake bruxism and sleep bruxism. Awake bruxism occurs during the daytime when a person is awake, and most of the symptoms get worse as the day progresses. Sleep bruxism occurs while a person is sleeping, and you feel the worst symptoms as soon as you get up early in the morning. In order to explain bruxism in detail, first I'm going to explain to you what teeth grinding, teeth clenching, and tapping is. Teeth grinding involves making a chewing motion in which the teeth rub against each other. Clenching is when a person holds their teeth together and clenches the muscles without moving the teeth back and forth. And tapping is when you tap the top and the bottom teeth together. Bruxism happens due to many factors, and it's broken down into two types: primary bruxism and secondary bruxism. Primary bruxism occurs on its own and does not result from another condition. Some of the known factors that contribute to bruxism are age, so it's really common in young children who are just developing their dentition; malocclusion, that is how your bite is; and stress. Young children are more likely to experience bruxism when their teeth are growing, and bruxism usually resolves on its own once the dentition is completely formed. Secondary bruxism occurs as a result of another medical condition or circumstance, such as mental health conditions of anxiety and depression, neurological conditions such as Huntington's disease and Parkinson's disease, and a sleeping disorder called sleep apnea, which causes disturbances in sleep, cause significant discomfort, and lead to severe dental damage over time. It can cause attrition, recession, abfraction, small cracks and chips in teeth, fractured teeth, can lead to sores inside the cheeks, swelling along the jawline right over here, and cause limited motion of the jaw, as well as disrupt the function of the TMJ. TMJ is this joint right here, which is responsible for opening and closing motions of the mouth, as well as chewing movements. And outside the mouth, the bruxism can also cause you headaches, neck and shoulder stiffness, as well as stiffness and pain around the ear area. Dental attrition is the loss of tooth structure or tissue caused by tooth-on-tooth contact. Gum recession, it happens when your gum tissue pulls away from your teeth, exposing the roots underneath. And abfraction is the loss of tooth structure where the tooth and gum come together. Now I'm going to discuss some of the treatment options of bruxism. Oral appliances, referred to mouth guards or night guards, are removable appliances that are custom made to fit over the patient's teeth, and they are the most common treatment for bruxism. Mouth guards are fabricated using detailed impressions of the patient's mouth and patients typically wear them at night to prevent grinding and clenching. They can be worn during the day, especially during stressful situations such as driving. Moreover, restorative dentistry and bite correction can be treatments for dental damage depending on the severity and type of issue. Orthodontic treatment can be used for malocclusion. Dental crowns can be used to restore worn or broken teeth to their proper height, thus reducing the urge to grind. Restorative options such as dental bridges, dentures, and implants may be necessary for teeth replacement. Lastly, in extreme cases, oral surgery may be required if the jaw or the temporomandibular joint, the TMJ, becomes dysfunctional. Fortunately, there is no medication that can cure bruxism. However, painkillers and antidepressants can be used to reduce pain and relax muscles. Ibuprofen can be used to relieve any pain and swelling associated with bruxism, but that can only be used for a short period of time. People with chronic stress and anxiety may be prescribed antidepressants to manage their stress and anxiety levels, which may help reduce the effects of bruxism. Mild bruxism may not require any treatment and may be prevented or even eliminated if you pay attention to your symptoms. If you experience awake bruxism, next time remind yourself to stop grinding and clenching your teeth. One must try to do everything before it becomes a bigger problem. Now let's talk about treatment fees associated with different dental procedures as a result of dental damage caused by bruxism. For a typical mouthguard, you can expect to pay anywhere from $380 to $500 plus any lab fees, which can cost around $100 to $250. The average price of crowns ranges from $900 to $1,500 per tooth. Metal crowns made of gold alloy are costly and they cost around $1,500 per tooth, while porcelain crown costs between $900 to $1,000. It is a bit of a cheaper option. Cost of a dental implant is $2,500 per tooth, and cost of a partial denture is $450. Now you know everything about bruxism. The key is to understand and seek treatment to prevent dental damage before it even occurs. Thank you for your visit today and have a great day.